Assalamu alaikum. My name is Dr. Sahar Afshan, and today again we are here with public health approach to suicidal prevention. Um, I'm an ex-SMCN, previous SMCN, and it's great a privilege to teach for JSMU through Apna platform. It's a great opportunity. Suicide is recently with coronavirus, the mental health, everybody's mental health has been affected in the most different way we could imagine. And in this during this situation, we have seen a lot of suicidal tendencies in the industry, and we've been hearing a lot of news regarding suicides of different people. And so suicide is a very sensitive topic, and it's need to be spread out in a very unique way. And how we can prevent suicide, I think the most important factor regarding suicide is that, especially during this time, it's the idea that suicide is actually preventable. A lot of people think that suicide is just more of an instinct and impulse, which is very true. It have people decide in moments of time. It is common in young youth children, but the idea is how we can, as health professionals and the public health community, um, design and strategize prevention of suicide, because suicide is basically premature death. It is a form of death which has um, no previous, like, it is not supposed to happen. It's more intentional, and definitely we can prevent it as a health community and keep our communities safe. So we start with public health approach to suicidal prevention today. Uh, so again, from an introduction point of, what is suicide? Suicide is a significant cause of premature death in the world. It affects people with all ages and backgrounds all over the world. And death by suicide have a devastating, and of course, it has a huge impact on the families, friends. When if God forbid, we come to know that someone dear to us, he committed suicide, or even tried to commit suicide. It's such a disturbing news, and we can't just our mind doesn't accept the idea. Why would somebody do that? So there's apart from facts and figures, um, we really need to take this idea very closely. That why does it happen and how does it happen? Every year, a lot of people take their own life and attempt. A lot of people. When I was in ER, I used to see young girls between, I would say, 18 to 22 ages of that, young boys. They were committing suicide due to personal issues, anxiety, depression, and various reasons, job, financial losses, fear of failure, anxiety. So all these are factors that lead to suicide. So again, what is suicide basically? Suicide is a complex issue involving biological, psychological, social, cultural, spiritual, economic, and other factors, as well as the physical environment. This is a very important fact, that the physical environment of a patient, if you consider suicidal patients, um, patients with tendency of suicide, the physical environment plays a very major role. Loneliness, um, no close friends. They have, along with, different trigger options like alcohol, drugs around them. They play a very important major role in attempt to suicide. Again, these factors, when people they interact with their environment, and they see such depressing ideas around them. Um, Especially alcohol and drug is very strongly related to suicide in young youth, especially. So these are all triggering factors, and they basically indulge the person towards this drastic step. So that is why keeping when we are depressed, or we suspect anybody with a situation like this, his environment should be very safe. And by safe environment, he should be in a lighted room with the people around him, that shows that he's scared and he's being seen as someone significant. Another, if we say the stigma associated with suicide and mental illness, the fact that a lot of people that they're discouraged to seek help. This is something very, very common. This is something very important. A lot of people, they don't see themselves seeking out help because they don't know what is going on with them. Self-awareness is very important. We need to understand that we are going towards a downhill in our mental health issue, and we need to ask people and go out and seek help. And there's nothing wrong with it. In this world of social media, and a lot of people out there. I myself run a mental health forum for women for different personal and social issues to help them out with their problems and try to relieve depression out of them by understanding behaviors, by making them understand what happened. I think confusion and anxiety is another factor that leads to the thought of suicide, and the fact that I'm not good enough or I'm not needed and loved, especially in women being emotional being. This is a very common factor. So suicide is not necessarily just the wish to die. Uh, it's the feeling of being incomplete. It's the feeling that I'm not good enough, I'm not worthy. My being and not being in the world is not going to make a difference. So why not just it's more like the pain, emotional pain they're in. They just want to finish that pain, and all they could see as an option is killing themselves. So we talk about what are common causes of suicides. Um, if we talk about this, the factors, uh, suicide, mental disorders, definitely depression, alcohol use, drug use, abuse, substance abuse is one of the causes because it gives you the highs and lows of moods, and they impulse you towards taking drastic steps. Another one is many suicides happen impulsively. Yes, that's very true. Recently, there's this death of Sushant Singh that happened, Indian actor. That was the talk of the town, and most of the people they said that we met him in the morning and he just seemed all right. He was talking to us, he was he was himself, which was unbelievable. So this is very true. Suicide. I mean, patients already, especially diagnosed patients of depression, they have this high and low swings, and they have a tendency to go towards, but somehow just a moment of within 10 to 5 minutes that they decide they just want to kill themselves. This is why I say that having, if for diagnosed patients of depression, it is very important to be with around people so that they can notice what is going on with them, what are they doing, what are they thinking. It's a critical thing until unless the relatives, the family think that he's now in a better mental health, they should not leave him alone. Being alone, lonely, considering themselves a loser, triggering options, they just come in our mind within a matter of I think minutes, and we just want to find a solution to it, and that's usually killing yourself. In addition, experiencing conflict, breakups, divorce, relationships are very strong related to suicidal attempts. Not being with the person that you love. हमारी common society में अगर हम बात करें तो ये बात आती है. We talk about person की शादी ना होने पे बहुत ज़्यादा होता है. That's a way to believe that we are not complete without that person. Again, I always say relationships are a part of life. They're not your entire life. Breakups, not being with the person you loved is basically men and women both. It's not the person that you lost, it's more the connection that you lost. It's always regainable. But again, we need awareness, we need teaching for that. Disaster, violence, anybody who lost his family, everything during a natural disaster, a war, that gives a lot of trauma, post-traumatic distress. Violence, abuse, domestic violence is another common cause. For women, again, sense of violence strongly. Suicide rates are also high among vulnerable groups. That's very true. That is refugees, immigrants, lesbian, gay, bisexual, transgender, because they are those people who are basically left out from this society. They are kicked out of the society. They are not acceptable by the society. The people don't take them for who they are, and they are highly, highly criticized for who they are. But we as a society, we need to understand by the end of the day, they are humans, and we need to take care of people as humans rather than as labels. And this is what a good community is supposed to do. And we as health professionals, we have to take everybody equally, in a very equal way. So by far the strongest risk factor for suicide is a previous attempt to conduct a suicide. So the idea is, somebody recently asked me, how do we know that somebody is at the verge of committing a suicide? And I said, listen, the best way is that, does that person talk about killing themselves often with you? And the second one is, the idea that, did they ever try to do that, kill themselves through cutting, themselves, or they have tried, they have attempted suicide previously. These are two significant factors that kind of indicates the family and friends around them that he is at the verge of attempting again. So what are normal methods of suicide? How do people usually, we see this a lot, newspapers, through social media. How do people do that? It's normally self-poisoning. I remember my first ER case when I was in my house job was a girl who drank bleach in order to kill herself. She was a young girl, 16 years old, and parents were devastated, and it was very traumatizing for us as well. We had to save her, and she was lucky, she got saved, but it was very emotional that I saw that. And it was, I remember, one of my first rounds in the ER. Anyways, then the next is hanging themselves, or hanging is another common way. So prevention and control. Now this is what we are talking about. On a general scale, if you talk about prevention and control of suicide, suicides are very preventable. We need to understand this. Suicide is not a disease. It's not something that is just, if somebody thinks of it, that's it. Suicide is a situation, it's a condition, it's a behavior pattern that we need to understand, especially you guys being health professionals, you guys being primary healthcare professionals. If I take myself as a primary healthcare professional, this is very important when we see a patient with a tendency of depression and suicidal thoughts, because I get reached out a lot since I am working in mental health at the moment, with the fact that I feel like killing myself. I feel I'm not good enough, I'm not worthy. The best thing that you could do to your patient in this situation, first of all, explain why. Somebody say, I lost a relationship, somebody say, I lost finances, somebody say, I'm not getting the career that I want. And why are they related to it so strongly? Because they're emotionally connected to that thing, to that person. So when people are connected to emotion, other people, careers, and outcome, basically, and it doesn't go the way they want, there's a feeling of loss and that everything is over. So we need to educate them in the first place that whatever you have lost, no matter it's the person, no matter, especially I'm talking about breakups, and no matter it's your career, some people do not get the career they want or the job that they dreamt of. Everything is replaceable, and it just takes time. And it's the feeling of loss that works with the chemicals in our brain that gives us the feeling of pain, anxiety, and depression at that moment, and we want to kill ourselves. So it's basically a chemical reaction in our body, in our mind, that indulges us towards taking a drastic step. I've seen a lot of patients. I mean, recently I had three of my young girls who had similar conflicts, and they had different situations. Somebody was having a hard time at home and family, she wanted to run away and kill herself. The other one was, she had a breakup, a guy actually cheated on her, and another one was a divorce after a very strong relationship. So all of them, they had this similar pattern, and all of them were basically, they had this indulge of committing suicide, or that I'm not good enough, was that whatever they have lost is not replaceable. They had a very firm belief in the fact that the person they have lost or the situation they are in it cannot be rectified. It can never be corrected. And why did it happen to them? It doesn't happen to anybody else. Comparison is the root cause of depression and suicidal attempt. That the rest of the world is happy, but I am not happy. It's one of the reasons that people indulge themselves into depression and suicidal behaviors. So we as physicians, we need to prevent them in such a way that it makes it easy for them to look at. I think one of the best pattern was that I told my patients was, it's not the person that you lost, it's the connection that you lost. You lost a marriage, you lost a relationship. This relationship is totally replaceable. The person, it's not about the person. Breakups, it's not about the person, it's about the relationship. And relationships are definitely, it will take time. It's not going to be today, tomorrow. It will take time. Down the road, the relationship that you're longing for, you would get it. The job you're longing for, it doesn't seem possible here this way, but it would be possible in some other form. It's not the loss, it's not a permanent loss. People need to understand, patients need to understand that it's not a permanent loss. But yes, if you try to commit suicide, that would be a permanent loss, and you shouldn't go for that. Patients with typical depression, diagnosed patients with depression. So what do we do? What is now, when we have a patient with suicidal tendency, what is our responsibility as a physician, as a public health professional? What do we do? Because in primary care as well, you will have patients who come with anxiety, and their parents would come to you that my son or my daughter, I had a patient, I remember 7 months back, and he was a 12-year-old kid who wrote a suicidal note and hid it in his bag here in Canada. And his mother came to me that I'm stressed out. I want to kill myself because my son, he's just 12 years old, and he thinks he's not worthy because he's not able to get the grades that he wants. So he wrote a note that I wish I could kill myself. I don't belong to this world. They're better people. The world is not a place for me. So this is again in kids also due to social media, comparison, competition, and so much vanity around. Kids are this is a new challenge to us, that kids are prone to anxiety, depression, and suicidal thoughts, which is very depressing. But yet we need to start working at this level by introducing school-based interventions, introducing the idea that how to prevent themselves. This is why youth indulge themselves into drugs at a very young age, especially here in Western world. It's very common that young individuals, teens, they indulge themselves into drug, anxiety, depression, and it's more again by the environment, because the other person's doing, they feel high and lows of it. So but when the family comes to you for help and they want to know, because this, you would face this situation that a lot of people would come to you as a physician, they don't understand where they would go, they want to see a doctor for a solution, and primary care seems to be the first accessible point that they have. So the primary care physician, the family physician, is strongly associated to such situations. And if you see this, the idea, you will understand that you need to have a good hand on psychological aspects of the patients, in understanding behaviors of the patient, and how to prevent depression and anxiety from the patient. You need to have those consultation skills, um, that and to make a difference in the community. So we would say how to prevent and control suicides, reducing access to means of suicides. If the patient is he has already taught he has already talked to his family about the idea of killing himself or herself, you need to inform the family and the friends that keep him away from drugs, alcohol, pesticides, any sharp objects, medications, pills, and people need to be around them until unless they don't feel better, they don't feel that they are out of the thoughts, and they have talked themselves out of it. They need to be conscious, they need to be aware, because again, suicide is a very unpredictable action, and we need to be alarmed about it. Reporting by media, again, social media platforms are a very now a very good way, easy way to raise awareness among the society. School-based interventions, depression and suicidal thoughts in youth are very common nowadays. We as public health professionals and health community, we need to make interventions towards the idea that how what suicides are, how we can prevent it, what what it is about. Our kids need to know that, and especially this is being very common in this era of social media and all the gadgets that they have around, smart devices. Depression among children is becoming, and teens especially, is becoming more and more common. We need to work over that. Introducing alcohol policies to harm, like in Western world, alcohol is everywhere around us. And there should be prohibition policies for it, how to keep them restricted. Drugs and alcohol use, especially in young youth and teens. Early identification of treatment in cases when somebody talks to you about their families should be aware of the fact, the idea that I want to kill myself, I don't feel significant. Oh, this thing is just not working out, and I feel it will never will. They need to be aware that the other person is in a difficult time, and that person needs to be taken care in a different way. He is not in his best mental health status at the moment. And next is training healthcare professionals and non-specialized healthcare workers in the assessment management of suicidal behavior. Now, this is a very, very important public health approach towards suicide prevention, especially in low socioeconomic countries. A lot of effort is not being done this way. People are talking about it now through social media and other media platforms. But again, we do not really see any centers for mental health in Pakistan. We do not see any group of people or community that are working strongly towards mental health focus or behavior focus strategies. This is something that is lacking, need to be done. Follow up with patients. As physicians and public health professionals, we need to work on follow-ups as well. Applying a public health approach, suicide prevention is a public health issue. We need to understand that this is a health prevention, like it is a health issue. A lot of physicians think, oh, it's a psychiatric thing, it's just a psychological thing, the other person is nuts. What can a doctor do about this? Or what can a health professional do about this? This is a public health issue. It is a problem. It's a cause of premature death. And now I think after COVID-19, it would be one of the leading cause of death. It could be, God forbid. So we need to take care of it. We as Muslim community, we have our religious beliefs as well. Suicide is not allowed in religion of Islam. But on the other hand, all over the belt and still in Pakistan, we see this tendency. By focusing on a population or a community as a whole, protective factors such as community cohesion, culturally appropriate and safe programs and services, particularly at the community level, safe and healthy environments are, and grouping skills should be enhanced. This is very, very important, that we need to develop that platform as a Pakistani community, as a health professional community, to raise awareness and prevent suicidal attempts and prevent anxiety and depression in the community, typically mental health focus. This approach also looks, okay, despite the complexities, because somehow some of the patients, they are not really directly related to it, and we don't understand. But as health professionals, we need to train ourselves in order to diagnose mental health patients and work accordingly. So this is I found this chart that was very interesting, and I think that's very relevant to the topic. How do we do the early prevention before the suicide risk? Efforts to build protective factors and promote mental health. Promoting mental health, well-being, and reducing risk factors that can lead to suicide is very, very important. We really need to understand this. That raising awareness and promoting mental health, well-being is very important. You would hardly see nowadays people, they have everything, but they're just not happy. They have all that they wanted, they're just not happy. It's mental health is an attitude. It's something that we build within ourselves through education and awareness. So we as public health professionals, or we as health professionals, we need to make that change, really work over it. Population, it should be for everyone, every age factor, I think, and every class, color, gender, and background, right? Types of activities, social and emotional learning programs in school. Again, I said children are more prone to depression. And another thing I believe is school programs should be strengthened, because kids, they are very good at absorbing information. because I'm planning to work on a health program. So what I am seeing and what I have learned so far through my education is kids are very great at absorbing information. If you tell a child at a certain age that this is right, this is wrong, this is blue, this is black, and with the proper strategic planning as an intervention, they carry it a long way. They remember it for the rest of their life. So children are school-based programs are basically, it's like that. जिस हमारे यहाँ कहते हैं एक लैंग्वेज क्या कहते हैं कि जरखेज जमीन है, बच्चे हमारे यहाँ फ्यूचर हैं, जरखेज जमीन है, इसमें अगर जो पौधा डालेंगे वो एक तनावर दरख्त बने. If they have this mindset, what is right, what is wrong, how to prevent this, awareness and education at a certain age, they can carry this a very long way, and it would be healthy community in the future. So we really need to work on mental health literacy programs. We need to work on social emotional programs in school. How to deal with your emotions, how to deal with social detriments of health, what is mental health itself, the literacy program. Family, definitely there are a lot of factors. Family, they do not understand. I read this somewhere, and I think it was a classic line that I like. The mental health, anxiety and depression is a luxury that third world countries cannot afford. It was a statement from a father to his son who said, I'm not feeling well, I think I'm depressed. And I think this is a very common attitude. I saw it in a movie clip or somewhere. But I think that this is a very common attitude that low socioeconomic countries like Pakistan, India, and other countries, they do not consider depression, anxiety, mental health as a health issue. They just think it's just an anxiety or just a matter of age or it's a luxury, like third person said. So that's very true. We need to raise the awareness that it is a proper mental health issue and we need to work over it. The other one is stigma reduction, safe messaging campaigns, media guidelines, training for gatekeepers and first responders. What is an intervention? Intervention is a plan, it's a strategy. This is what we do. That if we apply this, like for example, obesity, what is the intervention to make? Physical activities within the community, healthy food, those are health interventions. So we have to apply an intervention for suicidal attempts. Individuals who are at high risk, they have previously committed suicide or depressed, people seeking help for someone else, survivors of suicidal attempts, people who have survived, they've already attempted, they wanted to kill them, but they survived. It should be strategies for them. Support and treatment, mental health services for them, emergency medical responding services, means restrictions that they should not be open to the means. Training and programs, survivors of suicide, population activity, peer support, that is group suicidal prevention, group follow-up with physicians, mental health groups, again, online support groups. It's a very good way of doing that. Training and counseling for first responders. There should be more people trained within this group. Responsibilities of the community, public health, and local governing bodies. What is now any prevention strategy? It's just not a work of one sort of group that only health professionals are responsible, only social workers are responsible, only the government is responsible. No, it's always within the collaboration. It's always a collaborated effort. So we need to work in collaboration with all the other communities. And how to make an impact? We need to build hope and reliancy that there's nothing wrong with it. Depression and anxiety, if you're facing it, just go out and seek help. There's always a solution out there, people who would help you. Promoting mental health and well-being. Promoting mental health and well-being. Ji beta. Promoting mental health and well-being, of course, is another factor. Complement current initiatives in suicide prevention. Be informed of current research and best available evidence. It's very important as a physician, as a health professional, to work with evidence-based medicine. And for this, we need researches, we need more literature reviews, and we really need to work over the fact that we can make a difference. We need to understand as health professionals, we can really make the change in the community that is wanted. Applying a public health approach, leverage. So what is suicide? What is suicide? Suicide can be prevented, collaboration, and it's definitely collaboration across all levels of the government body and a variety of sectors, communities. and prevention strategies help to set the stage for more comprehensive coordinated way to prevent suicide and promote mental health, well-being, inspiring hope, and building reliance. All these things can really make the change that we want in the society. Again, suicide is preventable, and we can really make the change possible only through our knowledge, public health strategies, collaboration, and prevent the stigma from the society and make the change, especially build a safer community, safer future for our children. Thank you so much. This is Sahar Afshan by suicide for the topic of suicidal prevention by public health. And any other questions, anything the students want to ask me? I work very strongly with mental health and I promote that. Any other personal questions, even you can reach out to me on my social media platforms or my email. Just comment on the video below, let me know, I'll reach out to you and see what we can do. Students are our future. We need to keep them mentally, physically healthy and happy for the best outcomes of the community. Thank you so much.